And I'm so excited to be part of this, and just for Georgia State and you, Evelyn, for putting all of this together. I think it's so great. But I will get started. Like we mentioned, today we're going to be talking about my career journey and how I was able to get a job on Capitol Hill. And everyone can see my presentation, right? Everything's good? Okay.
Yes.
Okay, so I'm going to start off with a little bit about me. So I am originally from Medellin, Colombia. So I was actually born there. I am first gen college graduate, immigrant, oldest daughter, all the tough ones, right? That, a lot of us, especially being at Georgia State, can relate to, being first generation, being the oldest, being, sometimes in certain spaces the only person of color. So I, wanted to share that as my background and something that I really have carried throughout my career, throughout undergrad, and even now into my master's program, and through my journey into going to Washington, D.C. Okay, so while I was at Georgia State, I was highly involved. I wanted to talk about the importance of being involved. Aside from, going to class, I know, like I mentioned, being a commuter school, some of us are on campus or were on campus, and some of us had to commute. I did both. I lived on campus, but I also commuted and lived off campus for a couple of years. So I know how that is. I know how difficult it can be to be involved in different organizations, especially when you have a course load to try to keep up with. So I was involved with the student orientation leaders, so like welcoming freshman students. You could see right here on the top left. I was also involved with SGA, which is another great organization. If you're looking into learning about policy, learning about government, SGA is definitely an organization that you want to look into because that's where you can get those opportunities. I always say that as long as you are volunteering, as long as you're, making yourself known and your presence and showing up to things, you don't know who you're going to meet. You don't know who is going to be able to offer you a job in the future. Connections are so important. Um, and then to talk a little bit more on the public health side, I was able to go on a medical brigades, which I believe, I'm not sure if Georgia State still offers that. I would look into that and then maybe send like a follow-up email. But yeah, with medical brigades, I was able to bridge, my work with SGA, but then also going to Nicaragua with, students from the public health program, people who were pre-med, people who were in the nursing program, and we were actually able to serve a community that needed help with OBGYN services. And as you can see in the picture, a lot of Georgia State students, but then also doctors. And, the medical system is so different in different parts of the world. So being able to see that was honestly like so rewarding as a part of my public health experience. So with that all said, I would definitely recommend you guys to look into organizations that you can join that can really help you discover what you like and explore like what you want to do with your life. I thought I wanted to go to medical school, and I decided now, with all the volunteer work and all the internships and stuff, I've decided that I want to go to law school. So, things change, and that's okay. Like you can shift, and things always end up working out. So I just want you guys to know that because it's very important, especially during the times that we're going through right now. And then okay, so I want to talk a little bit about my time before going to Washington, D.C. I think when people think about going into politics, the first thing they think about is, oh, we're, going to Washington, D.C., we're going to be in the Capitol, but there's actually district offices in Georgia that I would honestly recommend. And I'll talk about how to, get those internships, how to, you know, talk to your representatives and kind of get involved that way. But I think it is much easier to do an internship in at a state level, or not at a state level, but in your state. For example, I was able to work with Senator John Ossoff, and I was working in his state office first, but he has other offices all over Georgia. So Atlanta, Savannah, there's honestly, all in all the regions of Georgia, there's a Senator Ossoff's office, and they always are looking for interns. So that is a great way. I wish I would have known that when I was an undergrad because it would have made my path a lot easier. Before getting into the district office and working with Senator Ossoff, I was working at law firms. There's always law firms available or that are looking for a front desk clerk, someone who, can support them with filing things, with, just random things that if you are interested in going into law, I would say like starting off with basic like clerkships or going into an office and helping them pick up the phone. You don't know what that can turn into. And, working with an attorney, she knew Senator Ossoff and had some connections, and then she was able to connect me, which then, landed me a job working in his district office. So that being said, like it's okay to, start at a basic level. It's okay to reach out to people and ask them if they need help. It's okay to volunteer. And that's what I did. And, I was able to work with constituents, was able to support with the Department of Education, which, student loans and trying to help constituents. And when I say constituents, because that word is always like misunderstood. Constituents are all of you guys. If you live in Georgia, you are a constituent. I live in Georgia, I am a constituent as well. So, you know, being in the state, you're able to do more like working like outreach with your constituents, talking to your constituents. And then once you go to DC, or you make that connection and you apply to a job to work in Capitol Hill, then that's when you do more of the legislative work, more of the policy work. So, that was kind of my path. I went from working in a law firm, working in the state office, and then was able to move to working on the Judiciary Committee as as a legislative correspondent. And that picture in the middle, I wanted to share with you guys. That goes back to like what I was saying of doing volunteer work, doing internships. I was working with Senator Ossoff, and I still was, looking out for different opportunities. This was actually what they call it like a out of state, where you meet with different people from all over the country that are also staffers that are also working with a representative or a senator. And they actually took us to Toronto, which was really cool. We got to see how Canada and the US operates their border. So we were able to go in, and there, you guys should Google it. It's called the Peace Bridge, which divides, the border between Canada and the United States. We were able to go talk to officers there, meet with, people in the consulate, also the passport agency, and kind of see those operations that were happening within, Canada and the United States, which is really important to know, especially if, you want to learn about different things that Canada is doing as it relates to, public health or the health system. So, like I said, in anything that you do, always look for those extra opportunities. You never know like what it can lead to, and you never know who you will meet. Okay. So, let's talk a little bit about policy and how it intersects with public health. So, policy and public health intersect by enacting laws, regulations, and funding opportunities that address social determinants of health, expand access to care, and promote evidence based interventions at the population level. So, what does that mean? So, when we think about public health, we all know we all have studied and taken, very the basic public health classes and know that we talk about populations. Now, what policy does is you're able to write legislation. You're able to uh, figure out what regulations can help to support a community and improve the social determinants of health. We always talk about determinants of health, and policy is a great way to, create that change and promote, like it says there, evidence-based interventions that, can expand access to care, but can also really help those populations that are underserved in our country. So that's why I went into policy because I wanted to do work with public health, but I also wanted to create and write legislation, but then also learn about different avenues where I could also apply my knowledge in public health and create that change that I wanted to see in policy. Okay, so now we're going to get into how do you apply to your senators and representatives to their offices for internships. So as you can see, if you're interested in working with Senator Ossoff, the spring 2026 applications are on a rolling basis. So if you're interested, they are due by October 30th. And I'm gonna click here. Want to make sure that you guys can see my screen and that it loads. And if it doesn't, that's okay too. Okay. Okay. So you guys can screenshot the link, but you could just go to his website. It's very easy to navigate. You can go to Senator Ossoff's ossoffs.senate.gov, and you will find different positions. Right now they don't have any positions available, but if you go down, you can see that there are internships that are available that you can apply to in the DC office, in the Atlanta office, Augusta, Columbus, and Savannah, like I mentioned. And these are paid, internships, and I really recommend you guys to look into that being an intern because there's so many interns that start and then they end up, getting a full-time job working in Atlanta or even working in DC. So that's, an avenue that you guys can look into. And of course, you could use me as a resource, especially as you're prepping for any potential interviews. But I just, I would apply. Apply, you never know. You guys are all so smart and so capable that, I would love to see more Panthers serving in our congressional offices. Um, okay, now going back, talk a little bit about Senator Ossoff. It's the same thing for Warnock. You can go to their website, and it's the same exact thing. It's being a little slow, so I don't want to. Oh, there we go. Same thing. Washington D.C. internships. You can see the deadlines. Um, and there's also Georgia internships. If you're in school and you want to do an internship and want to try to coordinate your schedule, I think Georgia, internships are also as great as Washington, D.C. Okay, let's go back here. Okay, so another really great, and I can share this PowerPoint so everyone has access to it. Another great website is the House of Representatives. They have a House resume bank, so you can put in your resume and, for a job that you're interested. And what this does is every time that, a new job is opening, you will get an email. So this is also a great way to stay, up to date on what is available, and positions are always, open. I think sometimes we get scared because we think like, oh, it's Congress, oh, it's Capitol Hill, it's so scary, but there's so many more opportunities out there that, for some reason are not as like publicized or people don't really talk about as much, but they're, available and they're there. So this is for the House of Representatives. And same thing for the Senate. You go into careers.employment.senate.gov, and it's the same exact thing. And you can see actually there's a spring legislative internship. There's a spring press internship. So if you're into communications, if you want to do public health communications and law, there's so many things that you can do where you can merge and be a multifaceted professional. You don't have to stick to one thing and be one thing only. So here's some of the job description or job title. Staff assistant is a full-time job, obviously, and that's the next step um, after becoming an intern. And a lot of people go from intern to staff assistant, and then from staff assistant they go to legislative correspondence or legislative assistance, which are the next steps. So with everything, you can start off as an intern and move yourself, work yourself up, which is something that I wish I would have done, but of course I didn't know, these resources were available and these internships are actually open for everybody. So that's why I'm here, because I want you guys to know that. Okay, then moving forward, another really great website is USA Jobs. When you think of federal government jobs, you think of jobs within the Department of Human Health Services. I know right now it's a little bit iffy with, our current political climate. It's hard to think about public health from a lens of our current status in how our country is moving forward. But I think that we should still push forward and find those jobs that might not be 100% the CDC, right? Everyone wants a job in the CDC. And while, that is a dream of mine also, we can find other avenues to create change. And, having a federal job on your resume can really turn into so many different things and open so many different opportunities. Because once you work for the federal government, you also have, clearance, which means that you get your background check. Are employers are more willing to hire you because you have already gone through all the background checks. They've already looked at everything. And not to say that, like, they're digging deep into, your whole life, but I think it says a lot when you have a federal job or an internship on your resume. It looks really good for employers to want to hire someone who has that experience. So definitely USA Jobs is another one that you can look into, and that one isn't just like the Senate or the House of Representatives. That is all types of federal government jobs. Oh, okay. So I want to talk a little bit about my experience. I'm currently at GW and I'm getting my master's. That was, it was quite crazy when I was working on Capitol Hill and also doing my master's program. So now I've, decided to come back home. I am living in Georgia now, and I'm finishing up my master's program and focusing solely on that and also volunteer work, which I'll talk about in a second also. And honestly, my experience at GW has been great because I am allowed to do the online project or online school, and they have the entire program online, which gives me flexibility to not be in DC and still, be able to finish my master's. So if you are interested, like in a couple of years or whenever you graduate and getting your master's, I always think GW is great, and I think it's ranked on like top 5 of online master's programs for public health. So definitely would look into that. The professors are great. It reminds me a lot of Georgia State because, students just get it. Just like there's something about Georgia State culture and GW culture where like students just get it. Like the professors get it. They understand um, certain issues that are happening and why they're bad and why, we have to push forward as a public health community, even though it seems like, oh my gosh, like I'm getting a degree in public health and what am I supposed to do with it now? I feel like when you're surrounded around people who want to do good work, it gives you that strength to really want to continue to do that work, even if it seems like you're going nowhere. So GW is a great school if you're looking into it, and if you have questions, I'll have my email at the end too if you want to talk a little bit about getting your master's and what that looks like, even if you want to do it online and you don't have to be in DC. Okay, let me look at time. Okay, so now I want to talk a little bit about, like I mentioned, volunteer work. So I currently am volunteering with Emery's Farm Worker Project as a Spanish translator. So what you do there is we go to rural South Georgia, and we're able to meet with farm workers, and I translate for the nurses, for not just me, but other Spanish translators also come down and help the providers and the nurses, and we even have like PT, like physical therapy that goes out there, and we translate for farm workers while they're getting screenings like health screenings, getting their pressure taken. A lot of them have to go into what we call this mobile clinic. They go in and get, checkups from an OBGYN. So it really is a great project. I can also share more information on that. There's always, if you speak Spanish, you can be an interpreter and you can help, as most of the farm workers, most of the migrant farm workers are Spanish speaking and immigrants and migrants. And so it's really, really amazing to be able to have someone who is not only just talking your ear out and talking about all these medical terms in English, and then you don't understand. So having that bridge from a Spanish speaking person who can translate is always really important in any type of project that you do. So that's something to keep in mind, something to always incorporate in any of your future endeavors, or if you're implementing programs, or if you're implementing different projects in communities. Having accessibility to language is such makes such a huge difference makes such a huge difference in any type of environment or community that you're in. So yeah, that's us. We actually have a project, a clinic that we're going to be doing in October. So the end of October, I'm really excited for that. That's going to be my last clinic for this year. And with that, kind of going into my master's program, I really wanted to do something in Georgia, do my thesis, something related to, community in Georgia and immigrants. So I'm going to be completing my thesis in comparing a comparative analysis of occupational health protections for U.S. migrant farm workers. So what that means is I'm going to be looking into different policies, like I mentioned earlier, the intersection of public health and policy, different policies in at different state levels, where farm workers aren't being protected, where there are different disparities within farm workers. For example, a lot of farm workers have to deal with like heat exhaustion, which is something that, in South Georgia, getting closer to Florida, it is very hot, especially in the summer, it gets so hot. And a lot of times they don't have protections for these in these conditions. Another big thing is that I've seen while talking to some of the farm workers is the disparity of food. Although they're the ones cultivating our food, they're a lot of times they don't have food to be able to stay healthy and have that energy because there's no transportation in rural Georgia, in certain parts of rural Georgia. So a lot of times they're going to the grocery once a week, with someone who picks them up on a school bus, and they all take one ride to Walmart, um, 20, 30 minutes away, and they have to get everything for the week, and if they don't, that's that. So a lot of food disparity. Another big thing is exposure to pesticides. I really wanted to look into how that exposure affects farm workers and then their health outcomes. So how can we gather all of these notes and all of these disparities and violations to their rights, um, to create policy changes at a state level, but also at a national level? How can we integrate certain protections? And when I say integrate, certain protections exist. A lot of times people do not follow them. How can how can we look into really making sure that certain farms or certain, what do you call it, employers that are bringing these farm workers from other parts of the world, how can we make sure that they're, following these rules and regulations that either exist or that need to be implemented? So that's something that I'm really excited about. And I feel like it's definitely a culmination of all of my policy work, but also my public health background. And yeah, I'm excited and looking into the future. Like I mentioned, I thought I wanted to go to medical school, but I actually want to go to law school. So once I finish my MPH, the next steps would be law school. And like I said, I want to integrate my, experience with judiciary work, with law, with creating policy, writing bills, and, you know, touching into public health and how, public health is under attack right now. Obviously, like, I still have to go to law school, so I can't go into a courtroom and start arguing. But I want to work towards that to be able to protect our community members, especially community members like immigrants, people of color, low income. That's something that I'm very passionate about in being able to serve those communities, as I myself am an immigrant and also once low income. So um, definitely, a passion project for me. And the biggest thing that I want to talk to you guys about is the ability to be able to be who you want to be as long as you're happy and as long as it brings you joy in life. You don't have to be this cookie cutter, this is how you do it. There's only one way to do it. I think you can be a lot of different things. You can do policy, you could do law, you can do public health, you go to medical school. Like, there's so many avenues and there's so much more to just like doing things a certain way. And I think my story is kind of a representation of that. Whenever I talk about, my career and everything that I've been able to accomplish, sometimes people are like, "How does it intersect?" And I'm like, "It intersects very well." It's important for us to know, you know, from a public health standpoint, how communities work at a population level, but it's also important for us to know the law and know how we can apply certain laws to create change and how we can implement better regulations, like I mentioned in this example, how to better, protect our farm workers. So, yeah, that's why I love Georgia State. I feel like we're all so unique and it's okay to be unique. And with that, I wanted to share this quote. So, only when it is dark enough can you see the stars. Let us fill the sky with the light of a billion brilliant stars. So, some of you might know where this quote is coming from or when, VP Harris said this. I don't want to go into too much politics, but in terms of like, the race last year and all of that. Anyways, we don't have to get into that, but it's true. Like, right now it feels like it's very dark. It feels like, our rights are being taken away, public health is at risk. But I think that this is the time when you have to play defense. You have to get creative. You have to think of different ways to implement that change. And I think it's very, very apparent that Georgia State can be those brilliant stars. I'm always rooting anywhere that I go, whether it be when I go back home to Columbia or when have been in DC or other parts of the country. I'm always like, Georgia State, go Panthers. Like, have you heard of Georgia State? Um, because I think we're all so brilliant and I think that we all come from so many different backgrounds. So even though it feels dark right now, I think this is your opportunity to really take control of what you want your future to look like and really fight against, all these different odds and know that there is a community of people that are rooting for you. You have me now. You can connect with me on LinkedIn or even, email me because I want to give back, but I also want to make sure that you guys are in a place where if you have questions, you don't have to feel like, oh, like, who do I ask? Like, you have people that have done certain work that can help you and mentor and help you push forward during these really hard times. Okay, I think I ended a little bit early. So we can dive into questions. There's my email, my Gmail, my personal email. You guys can take it down and connect with me on LinkedIn. It's just my name, my last name. And yeah, it was really lovely talking to you guys. I'm excited to hear your questions. And yeah, thank you again.
Thank you, Sarah. This was really, really good. I learned so much from
Yay, that's
all of that
good.
yeah, I'm so, I thought was really good, and maybe everybody can agree that you provided where people could go to apply for internships. That is so helpful. And thank you so much for sharing your journey. That was just really insightful for even me to know. So I'm really excited that you got a chance to do it. You did have a wonderful turnout. Are there any questions for Sarah? I know she's ending a little early, and maybe that's good for some people. Are there any questions? If there are questions, if you don't mind taking yourself off of mute, and then we want to do like a quick little picture, because Sarah got to market this and stuff. She got to put it on her LinkedIn and her page so she can
Oh
show
my
everybody what
gosh.
she's up to. I'm just saying, we got to have a photo op. But are there any other questions before we do our photo op? And feel free to take yourself off of mute. I think you have the ability to if you have questions. If not, place them in the chat. And I'm trying to see if anybody does. It doesn't look like it. Well, the people that are on, would you mind if you're comfortable, but would you mind putting your video on so we could have your faces? I'm gonna do like just a screenshot for everybody, and we'll use it on our end for marketing purposes as well. Just to show the School of Public Health and the deans what we've done, as well as anybody else who's interested in any of the future public health power hours, and just to kind of see the turnout. And then, of course, it's for Miss Sarah as well. So if you are interested in doing it, that would be great. If not, I already did. So when you were talking, I took a like a screenshot of all the people that were here in the chat. Oh, it
Okay.
doesn't give you the option? Oh, shut up. Oh, that's probably on me then. Let me see.
I
Can
was
I
like, wow,
change?
they don't, I'm just kidding. I was
No,
like,
no,
really?
like let me No, it's probably a setting that I turned on. I'm sorry, Sarah. I was trying to
It's
do it. No, let me
okay.
I gotta figure that piece out. But no, I did. I did a full like
You're
picture. There are
fine.
people who was ready for you, the girl. They were ready to take a picture.
I was like, I want to see y'all's beautiful faces. I was like, okay. But it's
Well, so
okay.
what I will do though, I'll take one more good picture, Sarah, because the one that I have is you talking, and there are people in the picture, like some people's pictures are shown. So I'm gonna take another picture if you don't mind, just smiling, and I'll smile with you, and then I'll send that to you too. Okay?
Okay.
You ready?
Yes.
Okay, ready. Okay, let's see.
Uh-oh.
I got it. We are good to go, and boom,
This is
we're
so
good to
funny.
go.
I wish I could see everyone's faces, but it's okay. It's okay. Follow me on LinkedIn and we'll connect that way. And if you have questions, you have my email. Yeah, I'm available and, we'll talk.
All right. All right, everyone. Thank y'all so much for coming. And this is recorded, so we'll put this on the website if you ever want to come back to Sarah's chat just to hear what she did and see the links. Hopefully, you captured the links. I did, as she was saying them and showing them, I put them in the chat. So please, please, please capture them before you get off of here. This was for you guys. I hope you like this first kickoff to our Public Health Power Hour this season.
I love
We
it.
will have another one coming up next week. So if you are interested in the next event on the 7th of October, please join us again. We'll have another Public Health Power Hour with another alumni. All right. And she's going to talk about response crisis. So, all right, you guys, have
Yeah.
a wonderful, wonderful day. And thank you
Thank
so much,
you.
Sarah.
Thank you guys. Thanks for
Bye.
putting this together.
You're
Bye.
welcome. Bye.
Bye.